Okay, let's try again. I just got 5 minutes in, had a phone call. I couldn't get rid of it. So anyway, we'll start again. So today I'm going to talk about glute med tendinopathy. And I think you'll find it's sort of carrying on from what we've talked about in lots of the other talks. But first of all, we want to be a bit more specific today. So where is the glute med? Okay, your glute med is the muscle that sort of inserts into your greater trochanter. So you've got your greater trochanter. If you take your hip side to side, you'll feel your hip bone. Just behind that, your glute med inserts, okay? And above that, you've got your IT band. So what happens is if you take your hip over to the side too much, your glute med is compressed under that IT band and it becomes inflamed. And the tendon becomes very painful. So, you know, sort of what causes it. So a lot of problems come, it's quite prevalent, or it's very prevalent in ladies over 40, especially people new to sort of running, but not necessarily even just runners. I think the sort of menopause and that change of hormones actually sort of makes our tendons a little bit more vulnerable and sensitive to that extra load. So I see it a lot in marathon runners. I think one of the things to think about is what's actually happening when you're running. I think if we talk about biomechanics a little bit, everybody's biomechanics are individual to those. Your biomechanics don't necessarily cause your injuries. Your biomechanics will help us determine where your injury is likely to be. So if your biomechanics are terrible up in this sort of top end and your pelvis, and you haven't got your pelvis control, and this is happening when you're running, you're more likely to have problems up here. If your feet are rolling in, you're more likely to have, you know, problems low down. But who knows? It can be it can be anywhere along the chain, and also it can be, you know, more about age as well. Tend to be more sort of soft tissue problems as you get older because your soft tissue is less reliant. Less compliant, not reliant. So what happens when we run? Okay, when we run, you know, we stay nice and upright, pelvis stays nice and stable. When we're sort of, you know, we're not tired, everything's pretty good. What happens in marathon training, or when we get tired, or we've just done too much? Okay, you know that whole fatigue, you know, knees drop in, you know, hips can't control it, and everything just starts going a little bit rocking and rolling, and suddenly, can you see what's happening to my hips? This is all exaggerated, but as soon as my knees drop in, I can't control my hip mobility and my hip stability, because when I stand on one leg, if my knee drops in, my hip has to go across because I can't control that abduction of my hip. So as soon as my knees drop in and my core goes, my glutes stop working and everything becomes on stress, and that adduction happens more and more. So what we don't want is we don't want the leg crossing over midline. So, you know, if you find yourself running with your knees knocking together and your hips all over the shot, then it's likely that this part of the pelvis is going to be under stress, okay? Now, it can be very acute. You know, so people who have got hip sort of lateral hip pain, you know, I've seen some patients, it's really, really debilitating. It can be as debilitating as arthritis. So if it is acutely painful, what are the things that you can do? Okay, so the first thing is where, you know, what is it? And is it that? So it's very localized pain. You can't lie on it, and it can send pain down into that sort of lateral side of the quad to the knee. Okay, night's a big problem because if you lie on it, it's really painful. So one of the things that you can do if you have got problems at night, again, what we don't want is we don't want that leg crossing over, so we don't want that leg going into adduction, so you don't want to sleep like that. You don't want to lie on it, but equally you don't want it to be dropping over. So what you can do is you can lie at night with a pillow between your legs. So if you've got a pillow between your legs, your leg isn't going to drop over, okay? That's sort of the first solution. And so you're not going to wake up in the morning with a horrible sore hip. Okay, second thing is, if you're sitting, we don't want our hips to be lower than our knees, so just put a cushion up under your hips. If you're sort of sitting on the sofa, don't be sitting with your knees like this, because again, that compresses that whole pelvis area. Okay, so a couple of easy things that you can do just to help. And of course, we know we've talked about tendons a lot now. they don't like stretch. So what you don't want to do is lots and lots of those stretches, because actually all you're doing is you're just compressing it further. And actually what you want to do is you want to get it stronger. You want to do progressive loading. And I think the one thing that I've I want to reiterate is there's loads and loads of different forms of exercises. The best exercise progression you can do for an injury is to make sure it's progressive, okay? You need to start easy, you need to gradually load it without too much irritation, so you don't want pain the next day. You can have a little bit of pain while you're exercising, but as long as it's gone away the next day, you're fine. And you want to gradually load. So by the time you're at the top end of the exercises, you're lifting decent sized weights, you're doing slow reps, and you're starting to accumulate load via your sport, okay? So you can do eccentrics, isometrics, you can do static holds, you can do whatever you like. It's got to be progressive. And I think that's what they're starting to show in all the research is it doesn't really matter what you do as long as it gets harder, okay? And as long as you're loading that tendon progressively so that it can cope at the end with what you're asking it to do, okay? So let's take the glute med, let's take this. If you can't stand on your leg without pain, right, and without control, and it's drifting across, you should not be running. It's quite simple, yeah? And if it is that acute, that it's keeping you awake at night, it's good to start with a little bit of loading, okay? But it's good to start statically first and just doing some easy loading. So if it's painful to stand on one leg, that's not the best place to start. The best place to start is lying down. So we can do some static hip adduction. So if I just put that band around my legs, okay, and we go into this position, okay, so I want to keep my pelvis nice and forward. I don't want it leaning backwards and I don't want to tip it forward. I want it just to stay in that upright position. And then I'm just going to lift and I'm just going to hold, okay? And I'm just going to hold that and I can feel it working into my glute and I'm going to hold it for 5 seconds. And I might start off with doing 5 of those and you might actually find that that's enough just to start giving you some pain relief, okay? You can start, you know, as it gets a little bit less painful, you can start lifting up and down a little bit, but don't go down to the other leg. Start in neutral and lift up and down. And then, you know, you think, oh, I can do a little bit of control there, a little bit of rotation. So you're gradually sort of just using that leg in that position. Add a bit of resistance. Okay, we want to get a little bit of pelvic control. So you all know this one. Start off, rock your pelvis back, lift your glutes, hold it there and think, right, okay, that's okay. So they're your baseline, they're your first exercises. Right, and then think, okay, I can't lift one leg. Oh, if I lift one leg, my pelvis drops. Okay, I can lift one leg, but we're just demoing. So what you can do is you can then do a split bridge. See how I move my foot forward a little bit? And then you move it a little bit forward. Okay, and then you can hover it. And then you think, okay, now I can lift it. Okay, so then you can go on to some glute lifts. So you can have one leg in the air. And then you think, right, okay, see what my glute strength's like. Okay, that's not too bad. You can make it a little bit harder. We can turn around and we can go up. We have our legs on there. Now, it's probably a bit hard for me, and it's twisting, so it's a little even a little bit harder. So then we've got a bit of a harder glute, and then lifting again. Okay, so there are progressions of our glute bridge to make it a bit harder. But of course, we want to move into standing. Okay, bit painful standing on one leg. However, what I can do is I can stand by the wall and I can push my bad leg against the wall like that. Okay, so I'm doing a very similar thing that I was doing on the using the band, but I'm doing it in standing. Okay, and I can do that. Okay, then I can put that leg up, bend that knee and turn that knee out. Okay, and again I'm working this side now, so I've gone from working the left leg. Now I'm working the left leg again. Bend the knee, turn the knee out. And just do that. That one you can again do for 10-second holds. Okay, so they're nice ones just to start thinking, right, let's get a little bit of loading. And then you think, right, okay, I can't do a one leg dip, I can't do a one leg knee bend because it's still a bit painful, but I can do some mini squats. And I'm not taking my knees past my pelvis, my hips past my knees. I'm just doing some mini squats, okay, just to get a little bit of strength in that position. And you can do calf raises, okay, and then you can start doing some side steps. And step out and in, don't step back, okay, so out and in. Think, right, okay, that's good. And then you can start doing them the other way as well. Okay, now I haven't got a slidey floor in here, so I shall show you the exercise, but in fact, okay, come with me, because I think it's quite good to see this one. Right, put that there. Okay, we can just about see the floor. No, need to open that door. Here we go. There we go. Right, so towel on the floor, okay, and can we see that? Yeah. I just then want to just start. Okay, so I haven't got a Pilates reformer at home. I can't do any adduction work on there, but I can start doing a little bit of slide work. Okay, so let's go back into here. Right. Okay, so we've got the message, so we're progressing. We can do some slide work, we're doing some abduction. It's all about controlling that abduction. And you can do some simple hip hitching exercises on one leg and the other leg. So really, that's our progression. And so how do we then add our curative load? Okay, so if we've got no pain, daughter and dog outside, if we've got no pain standing one leg, walking, we can then start doing a bit of walking, okay? The next phase from walking is we could probably add a little bit of hills, you know, walking with a few hills and think, okay, just about cope with that, that's fine, no pain the next day. Then I think I'll start some easy jogging. Easy jogging on the flat, okay? Then you can start gradually increasing your distance, then you can add some hills, okay, and then finally you can add in some speed work. Don't bring everything in at once, only change one modality at a time. Then if you are flared up, so if you've brought your hills in, but you've also brought in a faster, longer run, you won't know which of those three things has made it worse. So only ever change one modality at a time, okay? So I think that the key is progressive loading. You've got to strengthen your abductors, the muscles that take your leg out to the side and give you your pelvic stability when you're standing on one leg. Look at your training. Have you done too much? If it's acute, let it settle down before you start doing anything, but you need to start letting it settle down with some easy exercises, because that is probably one of the best ways of getting some pain relief. And just gradually load it, and think, don't run into fatigue. You know, think about how you're running. Try and focus a little bit to start with on your cadence, and just think, right, if I can do shorter, faster steps, then I'm not going to overstride, and maybe I'm not going to spend so long with my foot on the ground, because it's when your foot is on the ground, that's when your pelvis moves. So if you're doing shorter, faster steps and your cadence is better, that might be enough just to change and just to allow you to get back from this injury. So hopefully that helps. Progressive loading, don't have the leg crossing over the other leg, and you know, just think about your training that you're doing. Okay, see you tomorrow.